Hello guys, today we are going to talk about the cerebellum. Initially we'll be discussing about the anatomy and then we'll jump on to the physiology. So in the sagittal section the cerebellum would be appearing something like this. So if you see here, this is the cerebellum and it's situated in the posterior cranial fossa beneath the tentorium cerebelli. So anterior to it we have the fourth ventricle and we also have the pons and the medulla. So coming to the functions of it, so the functions is it mainly controls the tone of the muscle, it controls the equilibrium or the balance of the body and also posture of the body. Now coming to the external features, so external features we'll have a model here. So embryologically this is how the cerebellum will look like. So because of the growth of the cerebellum and the limited space in the posterior cranial fossa, it gets folded into something like this. And here's where if we take a cut section, the diagram which we saw before would actually come. Right, so the external features. So we have two notches here. So this is the anterior notch, and after folding, here we have the posterior notch. The anterior notch is not so deep here, but the posterior notch is a little deep, and so this is shallow and this is deep. Now after the notches, so after this folding, what happens is the hemispheres of the we know, right, the cerebral hemispheres are there, the right and left. So it would be something like this, my hand. All right, so this is the cerebral hemispheres, right? This is how the cerebral hemispheres would be. Now in between these two cerebral hemispheres there is something like a median narrow worm like portion. This is called the vermis, and this vermis is both present. See, if after folding there is two surfaces, right? So this is the superior surface. Initially it was like this. After folding, this becomes the superior surface and this becomes the inferior surface, right? So the vermis, especially in the inferior surface, is more prominent and it's present in the vallicula cerebelli, right? And it's separated from the cerebellar hemispheres by a sulcus called as the sulcus valliculi. So this is about the hemispheres, vermis, and the introduction to that. Now coming to the fissures, we have actually three fissures. So the first fissure to develop here is going to be the posterolateral fissure. So this is the posterolateral fissure which separates this rest of the cerebellum from this is actually called as the flocculonodular lobe. So this portion is actually the flocculonodular lobe. So the first fissure to emerge is posterolateral fissure. It separates the rest of cerebellum from the the flocculonodular lobe. Now next we have, I told you there is a folding here. So this forms the horizontal fissure. So this horizontal fissure is by means by which we can separate between the superior and the inferior surfaces, right? So that is the second fissure. And third one is the fissura prima, which we'll particularly see on the superior surface. So this is the fissura prima. So it actually divides the superior surface mainly into anterior lobe, and the remaining is the posterior lobe. This is the anterior lobe, this is the posterior lobe. No, right. Now this vermis is further subdivided into many regions, and this laterally this cerebellar hemispheres is also divided into many regions. So we'll just say about the names of the vermis subdivisions. So actually if you see, these are the subdivisions of the vermis, right? So this is again these if you want I'll just show you. This is the superior surface, this is the inferior surface, and this is how it would be in the adult, right? This is how it would be in the adult. It's the flocculonodular lobe. So I'm just opening it up, and what are the vermis subdivisions if you see? So the anterior most is the lingula, and then we have the central lobule, we have culmen, we have declive, then we have the folium, then we have tuber, and then the pyramid and uvula and the nodule. So these are the subdivisions, and we also have subdivisions in the cerebellar hemispheres also, but that's not so important for understanding its function. Okay, Now, what am I talking about? The anterior lobe is in front of this. Yes. So this anterior lobe is something in front of this, and then the posterior lobe is something. This is something. This fissura prima is what is dividing it into anterior lobe and the posterior lobe. So in front of, or in the superior surface, in front of the fissura prima is the anterior lobe. All these things, and then posterior to it from here in the superior surface, then it also continues to the inferior surface, and before this, that is the posterolateral fissure. Up to that, it is the posterior surface, posterior lobe, and then we have the nodule and the flocculus. This is actually called the flocculus, right? So this is the flocculonodular lobe. So these are the anatomical lobes here. Now coming to the functional classification, right? For functional classification, we have this here. So we actually have three functional classifications. That's archicerebellum, paleocerebellum, and the neocerebellum, based on in which stage of evolution or how recently they actually evolved, right? So the archicerebellum is also called as the vestibular cerebellum. It is the oldest cerebellum. So oldest cerebellum part to develop, right? So it actually contains the flocculonodular lobe and the lingula. So what are the parts of the archicerebellum? Anteriorly we have the lingula, and here the flocculonodular lobe. How to remember this? So we just see in adult, these two are in close approximation, right? So this lingula and the flocculonodular lobe. So these two belong to the archicerebellum. So it's also known as the vestibular cerebellum, right? So its main function is to maintain the equilibrium, and this equilibrium is via the vestibulocerebellar tract. And about this nucleus we'll be discussing in short. For just for the time, you just remember that it is the vestigial nucleus which actually maintains this vestibular cerebellum. Now second part is the paleocerebellum or the spinal cerebellum. So this is the next in evolution, and it's not the it is not the recent, but it's next in evolution. So what does it contain is that it contains whole of the anterior lobe except the lingula, because it has gone to archicerebellum, and it also contains the pyramid and the uvula, right? Whole of anterior lobe except lingula and the pyramid and the uvula. So what is the nucleus here is, the governing nucleus is the nucleus interpositus, which is nothing but nucleus globose plus nucleus emboliform. This again we'll discuss in a minute. All right. So the function of this this paleocerebellum or the spinal cerebellum is mainly, it is to ensure that there is some crude movement is being maintained in the limbs. So it's not any specialized or skilled movements. It's just crude movements in the limbs. Now comes our neocerebellum, which is the most recently evolved. So it actually involves the rest of the parts. See what and all we have. This region we have the posterior lobe except the pyramid and the uvula. So that's what we have in the remaining, right? So this is what is being considered as the neocerebellum, this portion. All right. So what is its nucleus which is governing it? It is nothing but the dentate nucleus. And what is its function if you see? So its function is the smooth skilled voluntary movements via the cortico-pontocerebellar tract. Right, we know it, right? So from the cortex to the pons of ipsilateral side, and it goes to the contralateral side of the cerebellum. So this is the neocerebellum. Now coming to the deep nuclei, which I told you we'll be talking in a minute. So coming to the deep nuclei, we have 4 nuclei in number. So they are the dentate nucleus, emboliform nucleus, globose, and the vestigial. This order is important for lateral to medial tracing of the nucleus. So if we see this is the cerebellum, gray matters here, and inside that we have the white matter here. In the white matter there is masses of gray matter, that is what we call it as deep nuclei. So this if you see here this is the medial, this is the lateral side, right? From lateral to medial, if you are just going, we have the dentate, we have the emboliform, we have the globose, and we have the vestigial nucleus. Now this is about something which we are talking something deep, right? Now what is happening in this gray matter, that is called the cortex. So in the cortex we actually have three layers, and this three layers actually contains five different types of cells. So from outside to inside, what and all layers we have is the molecular layer, we have the middle Purkinje layer and the inner granular layer. The molecular layer is containing stellate and basket cells, and the middle Purkinje layer, as its name suggests, has the Purkinje cells, and the inner granular layer actually has the Golgi and the granule cells. Now one important note is that all the cells of the cerebellar cortex sends inhibitory outputs except the granule cells. This is the only cell in the cerebellar cortex which whose output is actually excitatory. So we can say that stellate, basket, Purkinje and Golgi cells use GABA as the transmitter, as the granule cells are going to use the glutamate as the neurotransmitter, which is excitatory. Now coming to the neuronal pathway. So this is the neuronal pathway. So we'll just come from here. Before that, there are actually two things we need to know. That is, the input for the cerebellum is mainly by two things. That is the climbing fibers and the mossy fibers. So climbing fibers are coming from inferior olivar nucleus, whereas the mossy fibers are actually arising from the spinal cord. Now these climbing fibers initially, they one important note before addressing about the neuronal circuit is that the climbing fibers and the mossy fibers, or the input fibers, are always excited. So these climbing fibers and mossy fibers initially excite the deep nuclei. These climbing fibers, what they do is that they excite the Purkinje cells also. But what is our nature of the Purkinje cells? They are always inhibitory. What I told you, except the granule cells, everybody is inhibitory. So the Purkinje cells will in turn inhibit the deep nuclei, right? Now this mossy fibers, what it does, it also stimulates the deep nuclei. Along with that, it stimulates the granule cells. Now these granule cells, which in turn will stimulate, because it's excitatory, it will stimulate Golgi, basket and the stellate cells, and the Golgi cells will inhibit the granule cells. This is called actually the feedback inhibition, right? Granule cells are activating the Golgi cells, but because this impulse should not continue again and again, this Golgi cell will again inhibit the granule cells. This is called the feedback inhibition. Now these granule cells activating this basket and the stellate cells, now it will inhibit the Purkinje cells, which was actually being excited by the climbing fibers, right? Now because of this inhibition by the granule cells through the basket cells, so this mainly is called as the feed forward inhibition. That is, the granule cells are feed forwarding the excitatory impulses to stellate and basket cells, which in turn will inhibit, or inhibition of the Purkinje cells is happening here. So the granule cells inhibiting the Purkinje cells is an example of feed forward inhibition. Whereas the Golgi cells inhibiting the granule cells is actually a type of feedback inhibition, right? So after this Purkinje cells are inhibited, now this inhibitory signals from the Purkinje cells to the deep nuclei has gone. Therefore this excitatory is alone present, which is very important for the start and stop signaling, because in patients with cerebellar lesions, the start and stop of the any movement is actually severely damaged. So this is the neuronal circuit. Now coming to the cerebellar disorders. So what is happening? What will happen if there is any cerebellar disorders? So if you see the cerebellar disorders, so there's no paralysis and all, because the corticospinal tract and all, it's normal here. There's no paralysis, but there may be perpendicular knee jerk is there, because this cerebellum also maintains the muscle tone and all. And so there's hypotonia, there's drunken gait, and there's scanning speech, and then there's dysmetria. So this one thing we'll do while practically examining the patient for cerebellar lesions. That is the finger nose test, or the finger nose test. So it is seen as pass pointing or pre pointing. So what is the meaning is that because the cerebellum is damaged, there is some inability to measure the length between the finger and the nose. All these are there, and importantly there is intentional tremors. Suppose there's a pen here, and if I want to lift it, then my hand will shake. So this is the intentional tremor. There's no resting tremor. All right, and then we have adiadochokinesia, that is alternate movements such as supination and pronation is actually not possible. This is mainly because of this start stop signaling failure, right? If it was present, then usually normal patients have this diadochokinesis. Because there is lesion in cerebellum, there is dysdiadocho or adiadochokinesia. So thank you guys.